Good morning, Mayor Kerner, Vice Mayor Weinroth, Administrator Baker, and the Board of County Commissioners. On behalf of the school board, I appreciate the opportunity to collaborate with Dr. Alonso and the Florida Department of Health and with the Board of County Commissioners. Dr. Alonso graciously updated our school board last week. It's through collaboration and coordination with local, state, and federal officials that our schools are taking deliberate steps to disseminate information about coronavirus and its potential transmission within our school community. As Dr. Alonso stated, it is imperative that we as a county and state leaders remain calm but deliberate in our efforts to inform and protect our community. As an educator and as a father of 2 children in the school system, I know how important it is to maintain a sense of normalcy for all of our children. Principals at our 179 district-operated schools are going about their day with their normal lessons as much as possible. While there are no known cases of coronavirus in Palm Beach County, I would like to assure the board, as I have the students, staff, and parents, that the district is being proactive. There is a lot going on behind the scenes. The district continues to enhance deep sanitation methods, which I initiated late last month. In the audience is Mr. Paul Strauss, who's the head of our Environmental Services Department, staff of professionals trained in environmental project management and infectious disease response. Our schools are also staffed with highly qualified nurses who are truly our eyes and ears as we monitor infectious disease on our campuses. These healthcare professionals report illnesses and trends so that the district can respond in real time and, when necessary, involve the health department. Additionally, district administrators have a comprehensive infectious disease response plan in place to ensure that learning continues in the remote chance that our normal operations are disrupted by an outbreak. In an abundance of caution, I have suspended district-sponsored out-of-country field trips. I am also recommending that students and staff cancel any non-district-sponsored international field trips booked through a third-party vendor. In-country, district-sponsored field trips are still permitted, but we will cancel if the health and safety of our students become a concern. In my continuance, who may be visiting high-risk countries over spring break, to be well aware of the CDC recommendations to self-quarantine for 14 days upon their return. I have directed district administrators to provide daily updates to parents and staff as the situation is evolving from day to day. The district has also launched a website available in English, Spanish, and Haitian Creole, dedicated to providing information and resources about coronavirus. The website is updated daily. In fact, this board meeting is streaming live and being recorded on our district website right now. For all those in attendance, please visit palmbeachschools.org/coronavirus for the latest updates. At this time, I turn it over to the chairman.
Chairman, you're recognized. Thank you, Dr. Fennoy, for those comments.
Good morning, Mayor Kerr. Son? No.
Yeah, make sure the button's pressed.
Good morning,
Okay.
Mayor Kerner, Vice Mayor Weinroth, Madam County Administrator Baker, and members of the Board of County Commissioners. I, too, would like to thank you for this invitation to collaborate and update you on the measures in motion to maintain the health and safety of our school district students and staff. We believe that it was important that both the superintendent and I be here today to ensure that the parents of our almost 200,000 students understand that both the school board and the administration take their concerns seriously. Like the superintendent, as chairman of the school board of Palm Beach County, there is no greater responsibility than representing the students and staff of the school district and ensuring that our campuses are safe and our children are as secure as possible from all threats. Our school board is united in its commitment to the welfare of our students and staff and will remain vigilant on our leadership through this current health concern and beyond. Despite being the 10th largest school district in the United States, our district is tight-knit. Our parents reach out to me and other board members directly with questions and concerns. I and my colleagues feel a personal responsibility to every child, parent, and staff member in this district. As a district, we are indebted to you, our commissioners, our health department, and other Palm Beach County leaders who are currently collaborating with us in an effort to prepare and persevere should coronavirus impact our community in general and our school district in particular. We will maintain open lines of communication with you. We will work collaboratively, and we will emerge from this stronger as a result of that collaboration and our combined efforts. On behalf of the entire school board, I thank you for the many years of support that the Board of County Commissioners has given to the school district of Palm Beach County. And I hope you realize the significance of that support, as it has had a positive impact on the lives of the many hundreds of thousands of children who have been educated in and graduated from your Palm Beach County Public Schools. Once again, thank you.
Thank you, Chairman Barbieri, and I'll alert you that I'm one of those former students that graduated from one of your great schools, so thank you. I'll turn it over now to Commissioner Weiss for questions.
Thank you. Thanks for being here. And, in other parts of the country, we've seen some school closures. And if that were ever to come to Palm Beach County and our schools, I know a lot of our children receive their meals at school. Is there a plan on how we'd be able to continue to support feeding those kids if that were necessary?
Yeah, so the good news is that the school district works hand in hand with the county during our hurricane protocols. And so all of those protocols, we would just activate all of those responses, and we would coordinate appropriately to make sure that we would have feeding stations for those who needed to access food.
Okay, thank you. That's my only question.
Thank you, Commissioner Weiss. Commissioner Bernard, you're recognized.
Thank you very much. Dr. Fennoy, I just have two questions. Can you tell the community, you mentioned spring break. I have 3 kids in the school system, so can you please tell when is spring break so the public would know when spring break is, and what would you advise to some of the parents and some of the community in regards to spring break?
Yeah, so spring break is the last week of March, so in 2 weeks we will commence spring break. Again, what we're asking as a school district at this point is taking advice from the CDC and other state and federal officials to limit international travel, to follow all protocols that have been established by all of our agencies around returning. At this point, we just need families to make wise decisions because, again, if you participate in international travel, there's a strong likelihood upon entering the country that you're going to be asked to self-quarantine. Or something even more severe if they find that you carry that disease. So what for us as a system during spring break, we'll be preparing for people returning and figuring out what those next steps. The good news, thanks to what I just heard the sheriff and Dr. Alonso say, we'll be able to have some information if confirmed cases are there, and then we will respond accordingly.
Thank you. One more question, Mr. Mayor. You had mentioned, in terms of not advising for, out-of-country trips, but what about, in-country trips, such as some of the most infected areas, such as California or the state of Washington or New York? What would you advise some of the principals and some of those individuals to work on?
Yeah, so the team, our team is sending out daily communication. Yesterday we sent out a pretty lengthy communication to our community, letting them know that we are monitoring every field trip case by case. And so we are absolutely, they have to come through executive cabinet, and we've already had to unfortunately cancel some. But we're taking it case by case, similar to what Commissioner McKinley said. We are not in a position that we want to just shut down the economy. So again, we're paying very close attention, getting the most up-to-date information and making those decisions. As I stated at last board meeting, as a superintendent, I reserve the right up until the day of to cancel any trip, depending on the information that we receive.
Thank you very much.
Thank you, Commissioner Bernard. Commissioner McKinley, you're recognized.
Yes, thank you. A comment and a question. Commissioner Weiss, there's an article in Politico today on that very subject about school officials pressuring USDA to expand access to free meals. Secretary Perdue is indicating that there are some glitches in the law that may prevent that from happening. There are a lot of exceptions, so it might be something our legislative affairs team can look into for us. Dr. Fennoy, 3 out of the last 4 years I had graduating high school seniors. Thank God I survived all that, but I got more than my fair share of 10 absence notices from my kids, especially their senior year. And what that means is basically if they have more than 10 absences, they have to pass the final exam no matter what their grade was in the class, or they fail the class. So for these kids that the parents make the decision to take them somewhere and they've got to come back, and the parents decide to do a self-imposed 14-day quarantine, what are we doing to make sure that that child's education will continue while they're at home, and make sure that that 10 absence requirement doesn't affect them?
Yeah, so the deputy superintendent and his team have developed a series of protocols in the event, and our IT department, if we have to have children at home to work remotely. Some of the decisions that relates to the 10-day absence will actually be augmented by the state because those are just rules that we follow. But trust me, we are well aware of that. My wife has asked me that question several times. And I said, well, my kid's going to school. Their dad just happens to be the superintendent. But needless to say, I think we were well aware of that. In addition, let me just say for the record, we've also been having conversations around graduation. As of today, we will not cancel any graduations, but we have made the decision to not shake hands at the graduation, just out of an abundance of caution. And any other further changes to those ceremonies, we will let the community know in real time.
Okay, and I don't know how you don't have arthritis in your hand from all those handshakes anyways. That might not be such a
the
bad
first
idea.
time the board told me that I would be at every graduation and shake close to 15,000 hands, I'm like, well, I'm 6'4", 300 pounds. I can take it. When I went to the chiropractor, my back was completely out of line. And then last year, Mr. Barbieri said, is something wrong with you? Because I just started breaking out at a graduation. So it is definitely a process of endearment, but I love it. And we look forward to doing everything in our power to keep kids in a normal situation as possible.
Thank you.
Dr. Alonso, you're recognized.
The issue about the 14-day quarantine has been mentioned several times, and I want people to understand that international travel level 3, China, Iran, South Korea, and Italy. Those are the only 4 countries that are on that level 3. The level 2 is Japan and on cruises. Those you just have to come home and make sure if you have any symptoms. You don't have to be isolated and you don't have to stay home. So, because there was a little bit of confusion. Travel, that is not correct. So I want to make sure people get that right from this presentation. They don't get confused.
Well, in all fairness to the papers, I think that was an initial directive from the CDC, who went back and then said only if you come back and you're presenting symptoms. So
they had to click on the CDC site to see which were the level 3s and the level 2s. We sent out a new information. I had to send it out to all my staff and to everybody because people didn't click the site to see what level 3 and level 2 were. So we try to clear it up by a new message.
Very good. Before I recognize Vice Mayor Weinroth, and while I have your attention, what is the practical effect of the governor's state declaration of the state of emergency?
It allows money to come down to the state when it's distributed, and thanks for all the House and the Senate that actually passed the bill, and the money should be coming down, so that's very helpful.
And what is the metric or metrics used by the governor's office to determine that that order should have been issued?
I'm not aware of the actual metrics. Usually most of our money comes down based on our population, so the more population you have, the money gets allocated. But I have no idea. I just take what we get. So.
All right. Vice Mayor Weinroth, you recognized.
Thank you. Thank you, Dr. Fennoy. I appreciate your presentation. A lot of parents who are watching today are probably thinking ahead about the possibility that the school system may have to react to a cluster of patients within a specific school or within the district in general. Can you let them know what the school district is going to do if there is a cluster? Is it going to be a system-wide reaction, or would you stay focused on the individual schools where there might be a problem so that they can start making plans for child care and again, disruption in the family routines?
Yes, so we are actually in the process, again, similar to hurricane protocols, doing tabletop exercises in reference to this. So the honest answer today is we would work directly with the CDC and the health department to determine as much as possible to contain it in one school. And then we would, but as we would get real-time information, then we would expand it. That is not a decision that the school board will make in isolation. It would be a joint effort to determine what the steps would be. I just know of a district outside of the state of Florida that shut down the entire system. But there are a lot of consequences shutting down an entire system when the school where the person was infected is almost 100, it could be 50 miles or 100 miles from another school. So we have to just be clear that those decisions will be made in a joint effort and it will happen in real time. But we're going to communicate as rapidly as possible and then put all the resources around those things at that time. Yes, sir.
Thank Thank you very much.
Thank you. I don't have any further inquiries from my colleagues on the board. As to the school board, thank you for your presentation and information today.